In today's video, we're going to talk about patellofemoral pain, what it is, and how to diagnose it from the comfort of your own home. And do make sure you keep watching until the very end of the video, as I'll be showing you a few physical tests that you can try to see if you have patellofemoral pain or not. And we're going to start right now. Just before we dive into the video, if this is the first time we've met, then welcome to Genuine Physio. My name's Luke and I'm a senior musculoskeletal physiotherapist from the UK. If you would like to know more about patellofemoral pain and all other things pain and rehabilitation, then consider hitting that subscribe button and tapping the notification bell so you get notified every time I release a new video, which I do every single week. Now, a good place to start would be to actually work out what it is called. There's lots of different names for it, and if we take patellofemoral pain itself, it can sound a bit long and confusing. But if we break it down, the patello part of the word refers to your patella, which is your kneecap. The femoral part refers to your femur, which is your thigh bone, and the joint refers to the area at which those two bones articulate with each other. So it just refers to pain around the joint at the front of the knee. It's also known as anterior knee pain and also chondromalacia patella. Now, patellofemoral pain is a diagnosis of exclusion, which means it's often given after injury to other structures within the knee have been ruled out. So some of the most common structures to be injured within the knee would be your cartilage, so your meniscus, you have some on the inside and the outside of the joint, and also your main ligaments, so your ACL, PCL, LCL, and MCL. If we have ruled out injury to those structures, then we may be thinking that you do have patellofemoral pain. So why does it happen? Well, there are a number of different hypotheses. We believe that it is pain or irritation behind the kneecap when the patella doesn't track through the groove within the joint perfectly or optimally. And it's often characterized by pain whilst loading into a flexed position. We believe that your biomechanics could have a role to play with this type of injury. So if your shin bone, so your tibia or your thigh bone, your femur is excessively rotated, if your knee tends to sit in a valgus position, so that is your typical kind of knocked knee position, or if you have excessively pronated feet, so that would be your flat foot position. We also believe that your soft tissues have a role to play within this injury as well. So glute weakness and quadricep weakness can have an impact on your symptoms. And we also think that muscle inflexibility can also have a role to play. So hamstring and calf tightness, we think could also contribute to patellofemoral pain. We also can't ignore the fact that we know psychosocial factors have a massive role to play in any injury. So things like stress, mood, thoughts, feelings, sleep, fatigue, and nutrition are also likely to impact your symptoms. Now, it can happen to people of any age, and unfortunately, in over 50% of people, it can last longer than a year. So that is what it is. Let's have a chat about how to diagnose it from home. So we'll start off by going through some of the questions that we would ask you to try and diagnose patellofemoral pain, and then we'll move on to some of the physical tests that you can try and back up that hypothesis. Now, one of the first questions we would ask you is how it came on. Now, typically, patellofemoral pain comes on quite gradually and slowly over a period of time. If you were to say that you had a sudden onset of pain that came on very quickly or sharply, that would probably decrease our index of suspicion that it is patellofemoral pain, and we might be thinking that it is one of those other structures in the knee that we were talking about earlier. It's very common for patellofemoral pain to come on after some sort of change in load. Now, load can be a change or increase in activity or exercise. It can also include putting on some extra weight. With regards to exercise, if you're a runner or a jogger, for instance, it may be that you've increased your mileage or speed or frequency of runs too quickly in a short period of time. It may be with regards to sport that you have been in your off season and you've gone back to pre-season training, and that increase in activity or load through the knee has brought on some irritation or pain. With regards to your weight, obviously you have the extra mechanical stress of being overweight that's going through the joint. We also know that if you do have more fatty tissue within your system, the way your metabolism works means that you are more likely to have chronic low-level inflammation within your system as well. And we know that inflammation is obviously not good news for tendon, ligament, and joint health. Something else we would talk about would be the exact location of the pain. Now, typically, people with PFPS tend to have quite global, diffuse pain around the front of the knee. So if you ask them where their symptoms are, they may touch their knee with their whole hand or even two hands just around the front of the knee itself. If you could pinpoint an exact location of pain, then it could be that other structures are involved instead. In terms of the type of pain that people experience with PFPS, it's often described as a low-level, dull, achy pain until perhaps they start loading into flexion. And at this point, they may say it is sharp or shooting. You wouldn't generally expect to get pins and needles or numbness with patellofemoral pain. So if we discuss loading into flexion, some of the activities that people often find uncomfortable with this condition would be going up and down stairs, running, hopping, jumping, or landing. Squatting tends to be uncomfortable as well at the end phase of the movement. Other things that can also be uncomfortable are kneeling down or sitting with a flexed knee for a prolonged period of time. Now, as with any good quality subjective or questioning examination or assessment, your therapist should already have a pretty good idea about what your diagnosis is. And then we would do the physical assessment just to kind of back up that hypothesis. So I did say if you stay tuned until the end of the video, we would have a look at some physical tests that you can try at home. So let's take a look. Now, unfortunately, most physical assessment tests are pain provocation tests. So we're trying to bring on or elicit some of your symptoms. Now, going back to some of the aggravating factors that we were talking about earlier, within a physical assessment, we'd look at some of those functional movements to see if they brought on some of your pain. You can try and palpate or have a feel around the front of the knee and the patella to see if that brought on some pain, but it's not necessarily that accurate a test. We did mention earlier that excessively pronated feet or knocked knees could be a contributing factor to patellofemoral pain. So we might start by looking at that first. But it is important to note that there's an awful lot of people that do have flat feet and don't have patellofemoral pain. So it's only something that we would maybe look into if things weren't improving with rehab. Looking at some functional movements, we could try a double leg squat first. And if that was uncomfortable towards the end of the range, when that knee is in that flex position, that could be an indication of patellofemoral pain. It might be that doing a double leg squat wasn't loading the knee enough, so we could try a single leg squat on the affected side and then compare that to the unaffected side. If that brought on pain, again, we might think patellofemoral pain. Another aggravating factor was going up and down stairs, so we could try this. Now, bear in mind with all of these functional exercises, it might be that your symptoms are not that irritable and doing 2 or 3 don't elicit the pain. It might be that you have to do 10 or plus repetitions in order to elicit your symptoms. People with patellofemoral pain often do find that going downstairs can be worse than going up, and that is because your knee is being loaded into flexion more. So the last one that you could try is a single leg dip off your bottom step at home. Thank you very much for watching. I do hope you found today's video useful. I'd love to hear from you, so do drop me a comment below the video and let me know if today's video helped you diagnose your patellofemoral pain at home. If you are new to the channel, then please do consider hitting that subscribe button and tapping the notification bell. It means you'll get notified every time I release a new video, which I do every single week. It also means that more people are likely to see this video, which hopefully you found helpful. If you did like this video, there's every chance you will like the video that I've done on how to treat and manage patellofemoral pain, and there's a whole playlist on the channel to help you manage your patellofemoral pain better at home. Thank you very much for watching once again, and until next time, I will see you again very soon.